Today we are back again with yet another episode of Nasscom Insights LeaderTalk. This time we have a very special guest with us, someone who is a healthcare transformation expert, and it is none other than Vijay Venkatesan, Chief Technology Officer at IKS Health. Vijay brings over 15 years of leadership experience driving digital transformation, innovation, and operational excellence across some of the most respected healthcare organizations in the US. Vijay has led enterprise-wide digital transformation initiatives, built predictive analytic platforms, and championed cloud and AI adoption to transform patient care and business performance. He holds a bachelor in computer and information science degree from Cleveland State University and an executive MBA from the University of Michigan. Beyond the boardroom, Vijay is a passionate mentor, music lover, family man based in West Windsor, New Jersey. Welcome to Nasscom Insights Leader Talk, Vijay.
Thank you very much for having me today, Achyuta. Looking forward to our conversation.
Thank you. Vijay, first question. A CTO like you does a lot of things today, right? Tech strategy, operations, integration, research, implementation, consulting, business development. But before we get started onto your current role, tell me and the audience a little bit about yourself, your journey to this date. How did you get here? What really inspired and motivated you on this path?
It's a wonderful question that I've spent years thinking about. No, I'm just kidding, of course. Again, just to start, I'm Vijay Venkatesan, Chief Technology Officer at IKS Health. My journey overall to this point is a combination of what I call inquisitiveness, persistence, and a passion for using technology to solve real-world problems. As a young man, I think I was very fascinated by machines in general, all kinds of machines, as how machines can streamline complex tasks, if you will. And my first aha moment was when I developed my first code that says "Hello World," which sparked my love for technology. So I really pursued a degree in computer science, focusing on software engineering, data systems, which gave me a foundation for how do you think about building scalable solutions. Early in my career, I worked for a software development company focusing on financial services, if you will, where I was starting to begin to understand how do you align technology with business outcomes. Later on, I found my passion in healthcare, where I saw it as an inflection point for me. Because healthcare is an industry where not only do you look at the world of technology and the data, not in the context of how it solves problems, but how it really improves the patient care journey. How does it improve, patient wait times at an emergency department? How do you make sure that you remove the friction that exists in healthcare? So I joined IKS Health because their mission to reduce administrative burdens and empower our clinicians to be focused on the patient care really appealed to me, and it kind of also appealed to my inner, service orientation to solving problems. Just at a macro level, I think of the world of technology always in the context of it is not about just writing code for code's sake. It's about enabling the human potential, and that's what continues to be my excitement, if you will, on an everyday journey, both at IKS Health and beyond.
Wonderful, Vijay. I think technology enabling the human potential, I think this is a motto that I think all of us should actually think whenever we look at technology with the kind of positiveness that you exude. Thank you for sharing your journey so far. Do talk to me a little bit about IKS Health, its growth journey, its story so far, key focus areas. What kind of problems is it trying to solve today? And how does it differentiate itself in this market where there are a lot of people who are actually focusing on, impacting the healthcare sector?
Absolutely. So as the CTO of IKS Health, I think IKS as an organization has been evolving since our founding in 2006. We started with a vision to take on what we call the administrative, clinical, and operational burdens of the US healthcare, if you will, allowing our providers to really focus on delivering exceptional care. Today, we have over 700 plus clients, including major hospitals and specialty groups in the US. We have a global team of over 12,000 folks, 2,300 approximately clinically trained staff and 500 plus technologists. And our mission is to enable the efficient delivery of excellent care. And the way we do it is through our care enablement platform, which really integrates technology, analytics, and our expertise to optimize revenue cycle, which is all about how do you reduce denials of claims, how do you enhance the clinical and patient experience. Our key focus areas are revenue cycle, clinical support, and value-based care solutions. In the US, we take on what we call the toughest challenges in healthcare, because there's a lot of inefficiencies in the US healthcare system, which cost on average about $760 to $935 billion annually. Where we come in is that we try to figure out how do we automate repetitive tasks. And we also used concepts like artificial intelligence to anticipate what are the issues we can prevent that reduces the friction in the patient care journey. So our unique selling point is we are the only integrated delivery platform in the market that spans clinical, operational, and financial functions. And we are delivering cost savings from day one. For example, our collaboration with a multi-specialty group, we have slashed their denials and boosted their economic value within a year. So we always say within our four walls, we just don't solve problems. We share the risk, ensuring financial accountability, and also thereby creating healthier communities with our technology in the context of patient care.
So thanks, Vijay. You did touch upon emerging technologies and AI. So my next question is around that, Vijay. So emerging technologies are increasingly recognized for their transformative potential, driving innovation, efficiency, providing new opportunities. Today, AI, GenAI has become the poster child for emerging technologies, providing boost in creativity, efficiency, personalization, innovation, new product development, you name it, you've got it. And Nasscom has done some work in this space in healthcare, AI in healthcare, and we believe that healthcare should be a priority focus area for AI adoption in India and globally, because it will help break the iron triangle of cost, accessibility, and quality. So how are you looking at emerging tech for growth? How is IKS Health really building a portfolio of solutions, or what are the big bets that you have around emerging technology in your organization?
It's a great question that many organizations are struggling with to a degree, right? With emerging tech, and how do you start? Where do you start? How do you focus? So I'll just give both a macro level view and kind of also talk about how we are approaching it as well. So emerging technologies, especially AI, generative AI, and now the concept of agentic AI, I truly believe are going to be game changers for healthcare, and specifically for IKS Health as well, because we are leveraging them to break that iron triangle, as you mentioned, of cost, accessibility, and quality. Our strategy is focused on what we call preactive AI, and that's something that we are very proud of. It's really using predictive and generative models to anticipate and address issues before they arise. So for example, our AI systems can analyze vast data sets based on the data that we have to prevent revenue cycle disruptions. Like, how do you prevent a claim's denials from occurring before the claim is denied? How do we streamline our clinical documentation, saving clinicians inordinate number of hours? These are the ways we are approaching the concept of AI, Gen AI, and agentic AI. We believe that the generative AI potential is massive because it can personalize. If you look at the macro healthcare system, it can personalize care plans. It can help with simulating clinical trials, and even reduce a lot of the administrative burden in terms of paperwork within healthcare industry. And as you know, that in a recent industry report, it's projecting that 64 billion in GDP growth for India's healthcare by 2030. So this technology is here to stay. And at IKS Health, we are investing in our proprietary AI solutions. We are creating IP that's enhancing our care enablement platform. So the concepts we are introducing are things like automated coding, or autonomous coding is a better way to say it, our patient engagement apps, and embedding predictive analytics for how do we allocate resources as well. Our goal at the end of the day is to make AI a seamless partner for clinicians and not a replacement, while also at the same time addressing ethical concerns like data privacy, bias through a very robust AI review board and a governance framework. Because we at the end of the day believe AI can only be valuable in healthcare if you are built it on the concept of scalable, trustworthy, and ethical AI. Because without that, innovation cannot occur that really truly transforms patient outcomes and also delivers operational efficiency.
Thank you, Vijay. I think I learned a new term today, proactive AI, predictive and generative put together. It kind of reminds me of Steven Spielberg's movie Minority Report, if you remember. And there they use those folks to, predict what they call as pre-crime, right? So there are
Correct.
interesting parallels, how in real life we start mirroring imagination that we put out in our movies and our books, right? So I think great to hear that. Could you share a couple of examples of IKS Healthcare's AI use cases, some things that you have monetized, and what is the customer feedback that you got? What is the ultimate impact that you were able to create? Any couple of case studies that you want to share?
Yeah, I'll speak to it at a very high level. At IKS
Yes.
Health, I'll say that our AI-driven solutions are transferring what we term as the healthcare delivery model in the US. So one success story that I'll briefly touch on, involves a multi-specialty medical group we partnered with. They were facing high claim denials, which was costing them a lot of resources in terms and their efficiency, if you will. So we deployed our AI-powered revenue cycle management tools, which kind of analyze their patterns in claims data to predict and prevent denial. So this notion of reactive AI, within a year, their denials dropped significantly, and the group saw a notable increase in their economic value. And even the clinicians told us that they could now focus more on patients and not on paperwork, which boosted their patient satisfaction and their focus on building the right care delivery model from a clinical point of view. Another example is our virtual scribe solution. We partnered with a rural health system where our AI-driven scribes improved their documentation quality. So in the US market, where we have to convert every visit into a clinical documentation, we were able to, I would say, using our technology, give them the gift of time, which really is key, because the more time a physician has, they could see more patients and also have time after the fact to spend time with their families. I know it sounds very elementary, but the documentation burden that a physician has in the US, that's where IKS comes in with our technology and says, we can give you the gift of time so you are able to focus both on your patients and on your personal journey so you don't have a physician burnout. What are the challenges we see as we think about AI? So integrating AI into workflows, there's always skepticism. And I think it's a healthy skepticism to have from a clinical point of view. So the way we have tried to overcome that is to use what we call explainable AI. And that means that as we build our algorithms and train our algorithms, we are able to explain how we got to those outcomes. And that is a foundation for building trust. And trust is key in the world of AI. And again, one of the key learnings we continue to emphasize is that AI is always there to augment. And I think the better term for AI should be augmented intelligence instead of artificial intelligence, because we're not trying to replace the human expertise or the stakeholders who are part of this patient care journey. Our goal is, again, not just to enable tech. We want to enable better care and build the human connections, because at the end of the day, healthcare is about that human element, right? So I started the discussion with making sure that we enhance the human potential. And that's what we are trying to do with all of our solutions.
Thank you. Great examples, Vijay. But Vijay, one of the, I'm sure you worry a lot about the future. Are there things that keep you awake in the night when you think about the next 5 years, next 10 years, what the future holds, the rate of change in technology that's happening all around us? future of jobs, the kind of shifts that are happening in terms of how we deliver, how we work, ethics, explainable AI, you touched upon it, R&D investments, your organization's strategy, pivots, etc. What really keeps you awake when you think about the future, Vijay?
It's a great question, Achyuta, and I think I'm sure everybody feels this in their daily lives. When you look at your iPhone today or your phone or your cell phone today, the amount of things it can do, which it was not able to do before, because phones were a concept of just talking to people. Now it's an extension of your identity almost. So as a CTO, I think a lot about the rapid pace of tech evolution and how it will impact healthcare as I think about the future. What keeps me up is making sure that we as an organization at IKS Health, we stay ahead of the curve while also remaining committed to our mission. And technology's role is also shifting, from being reactive to a proactive transformation. And if you think about AI predicting a patient needs or helping a hospital better allocate their resources or better use their scarce resources more efficiently. So when I look at that from that lens, I think about IKS in 5 years to be the preeminent care enablement platform that leverages AI and makes healthcare more equitable and efficient. So that's one set of focus we have as an organization. In 10 years, we could redefine the global healthcare delivery because we are able to integrate AI and devices in a more real-time personalized care context. So we think that technology has to be a complement to the patient care journey, to the healthcare journey, and we believe we are at the precipice of trying to redefine this global healthcare delivery model. You asked a little bit about the future of tech jobs, and how does the technology advancements impact that? To me, it's really about upskilling, because the future roles will focus on designing and managing AI systems and not just about coding. The old analogy is to be, if you learn the latest coding language, it is a differentiator. Now it's about how do you think about designing and managing AI systems and embedding this notion I touched on briefly, which is ethical AI. It's a critical component of the future state system delivery model. We must tackle bias, we have to ensure transparency, and in healthcare at least we have to protect the patient data, we have to focus on privacy, trust, and all those elements. So at IKS, for example, we are investing a lot in our R&D to build these responsible AI systems and partnering with clients to share in the risk and rewards. So one thing I would say is my biggest worry has always been about balancing innovation with accountability, ensuring that our tech not only uplifts our clinicians and patients, but we also make sure that it does that without any unintended consequences. So this worry about the balance of what I call trust, privacy, ethical components, and at the same time making sure that you are always focused on the unintended consequences and ensuring that it doesn't become a barrier to progress.
I think very well said, Vijay, and I hope in the future you also include to expand big time in India, because our healthcare sector is behind, and I think companies such as you can really make a lot of difference to the quality of life and the quality of healthcare services in India. So look forward to that piece also. Vijay, last question is around probably one of the most important questions for this session is that what advice would you like to share with your audience, given your vast experience, right? Today is a time when technologies are looked upon, technologies such as AI are looked upon both with excitement and apprehension. So what would be 3 success mantras that you want to leave for our audience? And they can include technology leaders who are in innovation-led organizations, students who are looking to build a career in tech, and startups who are struggling to identify white spaces and strategies to scale.
Yeah, it's a great question again, and I always say I can only share my experiential learning. I don't think of myself as a wisdom artist, if you will, but I will try my best. For technology leaders who are building innovation-led organizations, the first, they need to prioritize what I call a human-centered design. And in my mind, what that means is that technology should empower people, not overwhelm them. And as a technologist, I spend a lot of time on minimalism. How do you build technology that is minimally invasive? And the best thing I always said was, when you look at an iPad when it first came out, all you had to do was turn it on and it worked. There was no training documentation required to use an iPad. So that human-centered design, that it should not overwhelm people but empower, is a very key discipline. Second, I would say, is that you have to foster a culture of experimentation. You have to fail fast, learn fast. Most companies struggle with it because there is this not a notion of that not everything you attempt is going to succeed, but you want to learn fast to say what you should do and shouldn't do. The third is invest in ethical governance, because at the end of the day, your key currency is what people believe you're doing, and are you doing it with transparency. So that ethical governance is an important notion that should not be ignored. So lead with ethics first, and you will never make a mistake later, to avoid any unintended consequence. I think you also asked about, for students aiming for a tech career, what is this that they need to think about? The best advice I got early in my career is that be a student for life. Be inquisitive, because that is your superpower. Never stop learning. I think what they have to identify is that you have to identify a focus area where you can deliver a value proposition that doesn't exist today. Most companies make the mistake of attempting to do everything at once. And in the world of AI, I'll kind of break it down into 4 parts. Either you are a company that focuses on data that helps deliver AI, you're focused on a platform that can orchestrate AI, or you are a company that builds apps on the platforms that can deliver value to the end customer. So understand where you fit in this continuum. Second is leverage partnerships, because collaboration with players is going to be key. And companies like us, we focus on that a lot. We are not trying to say we have to build everything. We have to figure out where do we build, where do we buy, and where do we partner. And that's going to be a constant discussion in this evolving technology space, because you cannot build everything.
I think they're very profound, and I think there's a lot of commonality from previous leaders that we have spoken to, and I think that's where it is, right? At the end of it, leadership, the tenets are quite common for a lot of people. And my key takeaways from this discussion would be that technology is all about enabling the human potential, right? A new term called reactive AI is something that I will take out. Importance of explainable AI, ethics, ethical governance. I think that's very important for tech leaders. How can they prioritize human-centered design? For students, never stop learning, be persistent, be inquisitive. And for startups, always think about the focus, and always think about how you leverage partnerships and prioritize scalability right from day one. I think these are great takeaways. Thank you for again joining in, Vijay. And
thank you. And the one last comment I would leave with everyone is that the future is exciting, but demands responsibility. So embrace it with purpose. Thank you.
So viewers, hope you liked this Leader Talk. Nasscom's report on the topic of AI in healthcare is a very interesting one. Please find the free report download link in the description box. Please like, share, and subscribe to the Nasscom Insights channel. And I look forward to putting together another inspiring Leader Talk for you very soon. Thank you.
Thank you.